So the basically, if I want to give the one the common example, okay, if you see very commonly seen in the hospitals, okay, if any family member or anyone is undergoing to the surgery, even though it's simple surgery, a simple procedure, the attendant should sign the consent form. There they will mention each and everything with respect to the favor to the hospital, right? If during this process something's happened to the subject, they are not responsible, right? Obviously, doctors, okay. But here not the cases. That's a different. But just I'm saying that, okay, if any is ongoing, if any before starting the procedure, hospital staff and the doctor, they should take the consent of the subject, or I mean patient, or at least patient attendants. So they have to sign that, so they are willing to undergo the surgery, right? So likewise in the clinical trials also, each and every subject, first and important thing, they have to sign informed consent. Once they sign the informed consent only, they have to enroll in the study, otherwise they cannot enroll in the study, okay. So that rules will explain the part 50, and the part 56 is IRB. IRB is nothing but institutional review board, or IRB or IEC, institution of ethical committee. We can say both names, both are same, IRB or IEC. IEC is that institutional of ethical committee, IRB is that institutional review board. So this is the autonomous body. This board will regulate the clinical trials. Okay, they will check that each and every aspect of the clinical trial. So this informed consent, everything will be based on their rules only. It will be regulated. Okay. So then the part 312 is that IND. Like IND is nothing but investigational new drug, I guess. Investigational new drug. Okay. So new drug related things then we explain. In the part 314 is that NDA. So new drug application. So what I said in the very initial step, okay, any preclinical data, then they are going to file a NDA, new drug application. Means the pharma company is going to file a NDA. So and so particular drug we have invented. It is the result is promising on the preclinical trial data with respect to the particular disease. So please provide the permission for the particular clinical trial phase 1. So that's a new drug application they will file. They will review based on the result. They will give or they will reject. That's a different story. Okay. Part 600 and 6001 is the biologics. Okay. And then part 812, 813, 814 is the medical devices. So as I said, not only the test drug, it will be conducted in the medical devices as well. Okay. So in the Title 45 public welfare, I mean, these we don't require really in-depth details. Why? Because we are not a like other clinical support staff. We are a programmers. We don't require all, but it's good to have that. Just I'm explaining things. Okay. So in the part 46, BCD, DHHS, and the production of the human subjects. Okay, these are the some aspects of the human regulatory CRF. Okay, it's a code of federal regulations. Okay. So what about the international regulations? Okay, there will be some international regulations also that we can say that E6 and E3 guidelines. So the E6 is the good clinical practice, GCP consolidated guidelines. Okay, how you need to conduct a clinical trial? It's a very well organized thing, right? So the E6 will explain the good clinical practices. Okay, GCP guidelines. Okay, and then international ethical and the scientific quality standards for the designing, conducting, recording, and the reporting trial results. Okay, for this E6 guidelines will be there. Okay, why is human research is highly regulated? Okay, so the why is human research is highly regulated, that so there are few instances in the history. So based on that, these regulations were formed. Okay, so for the first, okay, transgressions leads to the make a law that protects the rights and the welfare of the human subject. I mean, some years back, okay, for example, very early stage of the clinical trial, we don't have these much regulations. Okay, so whatever they want, they have to directly trial on the human bodies. Some of the key incidents in the history. So based on that, they have developed the particular things. This is the highly regulated things. Okay. So the first one is that, okay. So Nuremberg doctors trial of the 1946 Nuremberg Code. Okay. So this is the one of the in the history, this is one of the disaster. Okay, so these are the things. Okay, I mean there are five here: the Thalidomide tragedy. Okay, so and then Tuskegee experiments and the human radiation experiments and the gene transfer experiment. These are the clinical trials will happen in the history. These are disasters. So the thousands of people lost their life in these trials. Okay, so when these trials is happen, that were not highly regulated. Okay, and then okay, this is a Thalidomide tragedy. So this is one of the drug is on the who have the pregnant ladies, they should take the particular drug. Okay, there's a Thalidomide effect, we can say. So due to this, the newborn babies will have the defective, I mean any particular what we can say, some birth defects. Baby will baby will born with the birth defects due to the drug, that particular drug. Okay, so there are n number of examples in the history. If you go and check in the Google these names, okay, Nuremberg trial, for example, I can give one example. Just a moment. If you can see in the Google, okay, this is the Nuremberg doctors trials of 1946. Okay, so the okay, so indictment was the file date 25th October 1914. The trial lasted from 9 December the year of until 1947. Of the 23 defendants, 7 were acquitted, with the 7 received the death sentences. The remainder received the prison sentence ranging from the 10 years of the life imprisonment. Okay, so who have conducted this clinical trial, this has impressed me with this. Okay, like out of these people, 7 were the death sentences. Okay, so what happened in this trial, so you can Google it. Okay, so it will explain each and everything. Okay, so just I don't want to go in detail for this. Okay, I just want to give you example. So after this class, if you want, you can just to explore these things, your and the Thalidomide tragedy. So these are the things. Okay, so based on this, they have developed some highly regulated rules to conduct a clinical trial. Okay, so then the informed consent. Okay, so now it starts from the clinical things. What is informed consent and how it would be beneficial from the subject and then some of the sponsor. So what is informed consent, that we will discuss in detail tomorrow. So there are few more slides to explain these basics. Okay, so I'll continue tomorrow. I'll stop it here. Is there any questions from anyone?